I've seen in my personal life and my professional career how Spanish-speaking patients often fail to properly understand medical diagnosis and treatments. Understanding those two is critical to patients' well-being as they may procrastinate on getting treatment or they may forego treatment altogether due to really not understanding the gravity of the condition or the illness that they are being informed of. This connects to contemporary media literacies because, in hopes to find a solution, the office that I work at implemented a way that they thought would help physicians better communicate with patients. I do work at a doctor's office, so we are constantly having, patient doctor interaction or just clinical staff to patient interaction as well. So, what they implemented was an interpreter language line, which requires clinical staff to call and request an interpreter in order to communicate with the patients who speak another language. The interpreter is to do the interpreting over the phone, which creates discrepancies because effectively communicating, we know, is much more than just hearing. Many patients from other cultures use much more to communicate, like gestures and even facial expressions, which are all things that a language line, through using a language line, you just can't see. I chose to go with the multimodal theory by Kress, which looks at how people communicate and interact with each other through speaking, writing, gesture, gaze, and visual forms. Multimodalities may include gestures, and in many different cultures, they are used to communicate. Because an interpreter using a language line cannot see these gestures, it can be a discrepancy in the communication between the interpreter, the doctor, and the patient. And when it comes to healthcare, there is no room for error. We want to make sure that, we get it right and the patient is aware of what's going on at all times. Another point is that just like the way something is said in English, it can mean something completely different in Spanish. There are many words in English that mean the complete opposite in Spanish. So the multimodal theory relates to this problem in my place of employment because these patient-doctor interactions require conveying correct meaning of medical diagnosis and treatments that are critical to the patient's healthcare and well-being. And through the simple use of a language line, where there can be a mixture of things going on, there can be, maybe loud noise in the office that day, which we do experience sometimes when we have a heavy volume of patients coming in and out of the office, or just, a staticky line. All of that can really get in the way of the patient understanding what the interpreter is trying to say over the phone. And another thing is they're not able to match gestures or facial expressions to understand fully what is being explained. And that can be really tough on the patient. There is always that chance that the patient may be confused or not understand what is being explained, which poses great risk for patients and clinical staff. And here is a diagram. Here we have the root causes of patient safety events. So we can see here how language barriers and limited English proficiency causes communication problems within the healthcare field, and for patients going to see a doctor. And so it says patient that goes directly to the patient safety events or greater risk for medical errors. So the fact that there's a language barrier will cause those communication problems, which lead to the patient safety events and greater risk for medical errors to happen. There's also culture barriers, and that's another factor that plays into the communication problem, which leads to the same, result in, greater risk for medical errors and safety events within the healthcare field. This other diagram demonstrates, by the diamond, which represents needing an interpreter, just how, at doctor's appointments, we have 70% of patients needing an interpreter. At a public hospital, a private hospital, other health professions, legal or financial, educational, employment. So it's really not just in the healthcare field. We're seeing this, everywhere, wherever there may be a chance for patients that speaks a different language to not understand, it is very necessary that they have that backup necessary so that the patient can, really just understand and always be aware of what's going on. The worst thing you want is for a patient, just to be in a room and nod their head, but really, they're probably not understanding what you're saying. So imagine going to a restaurant, misunderstanding what is on the menu, and being disappointed because you didn't get what you thought you ordered. This is exactly what is seen in healthcare on a daily basis because of language barriers and discrepancies in communication. Sure, getting the wrong meal is upsetting, but certainly not as critical as misunderstanding a medical diagnosis or medical treatment. A physical and on-site interpreter all day is what can help lower and even eliminate many of the discrepancies we see in healthcare. Fully understanding that there is much more to communicating than just, speaking and listening. Really understanding someone requires physically seeing and understanding, understanding gestures like facial expressions, eye movements, gait, which is very important in the healthcare field, and simply much more. By implementing this, we can feel confident about the information and feedback that the patient is receiving during the visit. It's time that we start seeing this as a major issue within the healthcare field. Being able to communicate with patients of all backgrounds is important, and making sure that patients feel confident about the care they are receiving, that is priority.